My name is Sandy Kugelman, and I live in Austin, Texas. And I was originally diagnosed with breast cancer in 2001. I had a mastectomy and chemotherapy, and I had no positive lymph nodes, and so we were pretty comfortable that the prognosis was good. 3 years later, in 2004, I had a recurrence. And at that point, we thought that it was just on the chest wall. As it turned out, it was on the chest wall and in my lungs. And so that's stage 4. Chest wall meaning the manubrium, that's bone. So it was in my bones and in my lungs. Since then I've been on a lot of different courses of chemotherapy and hormonal manipulations, and usually things work for a little while and then eventually they don't, and we switch to another one. Well, my bone mets, or metastatic disease in my bone, is on my chest wall, and it's also now on my rib. And I don't know if it's related, but I've certainly broken ribs before. Like on this dog's head, jumping onto the I was jumping onto the bed and landed on his head, and oops, there went a rib. Was it from the cancer? It's really hard to know. I think the potential for breaking bones is the main issue, and then the secondary issue is pain, because when you have cancer in your bones, you hurt, and sometimes if it's just a little bit, you don't really feel it, but if you hurt, then you have a whole other set of issues as far as how do you live a high quality life when you're in pain. You know, I really try to live my life without that in my head.
Right.
I do everything that I want to do. We go to the beach, we go tubing, we do whatever we would normally do. And I think that the only thing that would ever hold me back is pain or discomfort that would make me feel like it would be difficult to do it and unpleasant to do it. I'm not a person who generally exercises for the sake of exercise, but I'm active. I do everything that I would always do, and we're going to Canada. There's all kinds of. We've been to the beach. Just this summer. We do everything we've always done. The only thing that ever holds us back is money. That's just like everybody else, right? There's nothing that I wouldn't do because of the bone issues at this point. It's interesting because I've always really enjoyed working within the community to help people. Before I had cancer, I worked a lot in the breastfeeding world and in the birth world. And once I got cancer, my passion has really become to help other women who are diagnosed with metastatic disease. I am here. It is 6 years after my metastatic diagnosis, against all odds. And I'm not the only one living this long. And that's a possibility for you. That gives them the hope that some kind of treatment will work for them. And I love to be able to do that. I do really live for that. I find that incredibly healing.